those are the key findings from the interviews that we did with the Taliban. But they, of course, call into question the way that aid agencies have approached this situation. So broadly, we found two ways that most agencies seek to deal with this. The first is structured engagement. They engage at the Taliban leadership level, either directly or indirectly. They engage at the provincial level, and they engage at the local community village level. These are the ICRCs, MSFs, others who've been very public about this kind of engagement. And then there are the majority of aid agencies who rely on indirect engagement, who shy away from directly negotiating with the Taliban on access issues. Most often, they rely on what they call community acceptance, so using elders or other influentials at the community level to mediate access. But what we found in terms of talking to the Taliban and elders really calls into question the risks and the risk transference in this. When we talk to aid agencies, we talk to the managers and the heads of aid agencies about this, as well as local staff on the ground in the provinces we looked at, but in Kabul, elsewhere. And a lot of them talked about the undue burden on them, the lack of established policies. Managers at the top often said they didn't know what their local staff was doing to negotiate access, which again indicates that the burden of it falls on sort of the most junior staff in villages, often who are from those villages, probably susceptible to intimidation and other coercive tactics that the Taliban employs, as our research shows. This is what the Taliban said about elders, that if we find out an NGO is spying or doing something against our law, then we punish the elders, which is fairly straightforward and something we heard repeatedly. When we talked to elders, they had the same sort of comments. Talking to the Taliban is like talking to the wall. We ask them to permit projects, but they don't let us. And of course, in the first instance, this elder from Kandahar, they were threatened after approaching the Taliban to allow aid projects, because basically the Taliban didn't want to hear it, and they were told not to do it again. So again, this calls into question whether or not elders or civilians at the local level can actually mediate with an armed group that employs coercive and violent tactics against them. In terms of our recommendations, they're of course in the report, but one of the things that we found was aid agencies don't really talk to each other about what they're doing to negotiate access, even when they're working in the same provinces, districts, or villages. There seems to be a don't ask, don't tell, both within organizations, but among organizations. And often what you saw was the Taliban manipulating this, or other armed actors manipulating this. So if agencies aren't unified in terms of what they're willing to compromise, you can be undercut very easily. And this pertains to issues like having female nurses and doctors in clinics, having girls' education, whether or not to pay tax. Another is building dialogue between humanitarian and political talks. There seems to be very, very little dialogue between the political actors engaging in political negotiations or attempting to, and the humanitarian actors who, on the ground, negotiate on a day-in, day-out basis. So we've also recommended more funding for analysis and assessment of the situations in volatile or Taliban-influenced areas, as well as better donor dialogue and support for aid agencies working in these areas. So I'll hand it back to Kim.